Hi, I'm Dr. Gene DeLucia. I'm a DO and board certified in family medicine. I've been in medicine for over 40 years now. I was asked to talk a little bit about why LifeVantage. Well, let me give you a little background about medicine in general. You know, in medical school, we're taught to diagnose a disease. We're good at putting a name on that disease. And if it's a chronic disease, we're good at giving you pills to treat the endpoint of that disease, a symptom or a number, your high blood pressure, your high cholesterol, your high blood sugar. We treat numbers. Okay, we don't have pills to cure those diseases. And in most cases, if you have a chronic disease, that's what we do. And the problem with that is I got very frustrated with that because I didn't want to just treat an endpoint, a symptom or a number. I wanted to actually help my patients get healthier and live longer. That's the whole idea of health. But unfortunately, in Western medicine, this is not a healthcare industry. This is a disease care industry. And because of that, we unfortunately don't have a lot of interest in your health and good health. We have an interest in your disease. That's what keeps you coming back. That's what keeps you buying a lot of pharmaceuticals. That keeps everybody in business. It's a huge $1 trillion a year disease care industry. That was fine when I was young, but my patient's population was young also. They get something acute, we give them something for it, or they would recover on their own, and everybody was happy. But as I started getting older, my patient population started getting older, I started seeing more and more chronic diseases. And unfortunately, I was passing out more and more pills and becoming more and more disillusioned with Western medicine because I just didn't feel like I was helping those patients enough. I felt like I was treating symptoms and numbers. And so I started looking. For other ways to help people and myself, because as I was aging, I also was seeing more diseases. And I thought, this is no good. I don't like this aging, and I don't like this disease. In Western medicine, we're very good at what I call name it, blame it, and tame it. That's what we do. But I was not happy with doing that. So I'm a firm believer in the law of attraction. I think if you put it out to the universe that you're looking for something, it'll find you. And it did. And then for me, it found me in the way of an ABC News video. My UPS driver at the time, Brian Ceroli, got in past my front office, very persistent. I remember my office manager coming to me and saying, please watch this guy's video and get him out of my hair. He's bugging me. So I did. He came in with Fred Graves. They sat down, set up their laptop, and they said, we just want you to watch this video. And I saw ABC News video, and it was done because there was a published medical study on protandim NRF2, and it was shown, the published study showed that protandim NRF2 was proven to lower oxidative stress by an average of 40% in 30 days. And everyone tested. They tested people all the way up to 80 years old. Understand that lowering oxidative stress is hugely important. Oxidative stress is why we age at the cellular level. It's also connected to hundreds of illnesses, hundreds of diseases. So when I saw that, I thought, wow, this is a big deal. If this is true, if I can truly lower oxidative stress by 40% in 30 days, that's a big deal. As far as I knew, there was nothing like that. So I got pretty excited. I went home. Actually, I bought a bottle of protandim from Brian. I went home. I started looking at what there was at the time. There was a few published medical studies. I read through their patents, their studies. I looked to see who Dr. McCord was. And I just educated myself. And it took me about a week to really look through everything I could find. I went back and signed up. I couldn't buy the product anywhere else except from a distributor. So I signed up as a distributor. I got my protandim NRF2. And I started giving it to my family, my parents, my brothers and sisters, and the people I loved. I showed them that video. I said, look, I want you on this stuff. This is a big deal. I eventually brought it into my clinic. And the changes I saw were amazing. Myself, my friends, my family, my patients. I got a huge belief that I still have today in protandim. So that's really where I started. I was also asked to mention or comment on how I would approach another doctor. And I can tell you how I do approach and how I was approached. I was approached by someone asking me if I would watch a short video done by ABC News. And I was handed a couple studies. They were the studies, I think the first and second study done by LifeVantage on Protandim. I liked it, the first study. I still use it today. I like the number 9 study, Oxidative Stress and Health and Disease. I think those are great studies. I even highlight those studies when I give it to a doctor. I want him to be able to look at it quickly and see it. If I were you and you're going to your doctor, I would say, hey, is there any reason why I shouldn't lower my oxidative stress? Or, hey, do you think I should lower my oxidative stress? Most doctors are going to tell you, yes, absolutely. They understand oxidative stress as far as damage. They probably don't know NRF2. So I would at least approach them that way. Give them the ABC News video, ask them for their email address or whatever contact information you can get. Send it to them. Give them a couple of the studies to look at and follow up with them. Ask them when they could get back, when you can get back with them, because stroke their ego. Tell them, look, I really respect your opinion. I'd like to know what you think about this. And that's really why I approach a lot of physicians that way. The other way you can do it is this. Medicine has changed a lot. Most doctors now are not solo practitioners. Most doctors are now being bought up by big corporations and their employees. So when I see somebody, especially somebody I happen to know, I say to them, hey, is this what you signed up for? Are you happy in medicine today? Most doctors are not, because as an employee, they're being told how to practice medicine, how many patients to see, more and more computer work, less and less patient time, things that they're not very happy with. And so I always tell them, I found a way out. And then I explain a little bit more about what we're doing in LifeVantage. So those are some approaches you can use depending on your relationship with your doctor or whoever you're approaching. But I think those are things that would get the doctor's attention. For me, it was the science. And I think for most medical professionals, it's the science first. I don't think a lot of us are looking for a network marketing company to join. I certainly was not. But eventually, yeah, I saw the business for what it was. And yeah, thank you, LifeVantage. Got me retired in about 3 years. The other thing I was asked to just go over overview of some of our products. So obviously, Protandim NRF2 is our flagship product. 26 published peer-reviewed studies, now patented. We have exclusive rights to Protandim. It's exciting to be part of. It's exciting to see this company grow to $250 million, but it will be a multi-billion-dollar company someday. It's fun to be part of that. It's exciting to help people, and that's really why I got into this, because I saw a better way to help people than just sitting in my office and seeing my 25 or 30 people a day. So it's a lot of fun. This will be an everyday household name worldwide one day. I truly believe that. And I want to be part of that. So the Protandim NRF2 is clinically proven to lower oxidative stress by 40% in 30 days. Oxidative stress is why we age. It's cellular level. It's the rusting of our body. It's cellular damage. It's progressive, but it's also linked to hundreds of diseases. I want to help people. I want to help them be healthier. I want to help them live longer. And so that's what we have in Protandim NRF2. We now have Protandim NRF1, another hugely important product, another synergistic blend of herbs that will activate our mitochondrial production. So we can make new mitochondria. We can repair our damaged mitochondria. All our mitochondria and all our cells produce our energy, produce all our energy. So they get damaged by those same free radicals as we age. That shortens the life of the cell, that reduces the amount of energy our bodies can produce, so we can repair those mitochondria, encourage neogenesis, building new mitochondria, which translates into more energy, and more energy translates into a longer cell life and a healthier life. So that's really what we have. When we manufacture more energy with NRF1, we make more free radical production. So NRF2 is there to gobble up those free radicals. So I tell people these are made to take together. So that's really what I would like to have everybody on. Obviously, we have other fantastic products, our Vitality Stack with Omega plus vitamin D in it, things that we've recommended to people for years. Now we have the highest quality ones. And our very unique probiotic, which is time-released, made to make it past our stomach acid and then get down into the lower part of our intestinal tract where it's supposed to be. And then also added to it is a patented product called Wellmune, an immune booster. So we have many, many products. Another one coming out soon, which will be a huge, huge breakthrough. So I'm excited to be part of this company. Thank you for asking me to do this video, and goodbye.